And SDG 2, end hunger, achieve food security, and improve nutrition and promote sustainable agriculture. Clearly, these two goals are related, and our guest speakers, Professor Wodavira and Dr. Teluria Juarez, are going to enlighten us on these. Our first speaker is Professor Wodavira, who is the Dean of the Faculty of Food and Agriculture at the UWI St. Augustine campus and a professor of Agri and Environmental Soil Physics. He also serves as the president and a fellow of the Caribbean Academy of Sciences and is a member of the International Science Council's Small Island Developing States Liaison Committee. He champions the transformation of agri-food systems to ensure food security and resilient development for these vulnerable regions. So welcome, Professor Wodavira, and it's over to you.
Thank you very much, Madam Chair. All right, so thank you very much, Dr. Pilgrim and the other participants this afternoon. It's quite a pleasure to be here and to have this discussion with you on the SDGs and you making connections for progress. And of course, as somebody who is more in agriculture, I have tried to lean my discussion towards food systems, which I believe our next speaker will also expound on that. And it's important for us to look at the importance of this as it relates to SDG 1, zero poverty, which is something that is very, very important because we know SDG 1 is very critical as where there's poverty, of course, you don't expect that anything else will happen. And so it affects every of the other SDGs, as we're going to be seeing it. So, of course, SDG 1 is zero poverty, which is all about eradicating extreme poverty everywhere by 2030. And we know for SDG 1, of course, the goal is to ensure that poverty ends, extreme poverty rather, for all people everywhere by 2030. And extreme poverty simply means that someone who is living on less than $3 per day. And as we can see, as it stands right now, we have close to 1 billion people, about 808 million people that are still under extreme poverty. So is it realistic to say that it is reducing or completely eradicating extreme poverty by 2030? Is it reasonable to say that that is achievable? Because we still have 1 out of every 10 people globally that is living under extreme poverty, as we can see right here on the graph. Now, progress has been made significantly, as we can see here. If you look at it from 2015, when the Millennium Development Goals end, we made significant progress. There was a sharp decline in extreme poverty, as you can see. It was quite sharp until 2019. And with the coming of COVID-19, the pandemic, and some wars, conflicts, and so on, all that was achieved was lost, and we started seeing an increase in poverty, in extreme poverty. I'm trying to get a highlighter so that we look at it together. Right. So we're seeing here there was an increase in extreme poverty, in particularly from 2019 to 2020. And then after that, of course, there was also some gains. Poverty started reducing, but it was gradual. It was gradual, not as quickly, or not as sharp as we would have seen before 2020. And I remember last year I was in a high-level political forum in at the UN headquarters in New York, and talking about the small island developing states. It was clear that it has the achievement of the sustainable development goals have been reversed. So where there have been, it has become so negative that it was really a problem. So why does this matter? We know that the poverty is linked to hunger, is linked to poor health, it's limited education, and it creates inequality, significant inequality. And so achieving the Sustainable Development Goal 1 is very critical for the progress of all other SDGs, as we would have mentioned. And still looking at the global trends and progress and setbacks that would have happened, we can see that it is very closely linked to global food price index as well. Because you're seeing here, as we can see in this graph, from 2015 to 2019, the global food index was here, but we're seeing an increase from 2020 to 2025. And of course, as we would have mentioned, the pandemic would have had an impact in that, conflicts, climate change, and all those would have affected that. And we know our situation, particularly in the Caribbean, the impact of climate change. And we're in a region that is vulnerable to almost everything that you can think about. So that has really stalled the progress that we would have seen in achieving particularly the Sustainable Development Goal 1, which, like I said, influences all other SDGs. Now, if we look at the link with agriculture, it's a two-way link, because many of the world's poor are smallholder farmers, fishers, and rural workers. So we know that the rural area is the one that is mostly characterized by poverty. And all this, the farmers, the fishers, the rural workers depend mostly on agriculture. And agriculture is limited, is affected by poverty, because there are, you cannot access the technology that is required to advance it. You cannot access inputs and so on because of poverty. And because of that, you have low yields, you have poor productivity and vulnerability, which can lead to hunger, and the cycle of poverty, continues. And of course, we have mentioned in the Caribbean, if we look at the Caribbean example, the impact that we have or the vulnerability that we have, particularly to climate change, that impacts significantly, because the agriculture is always at the forefront of these impacts, because the first thing that is impacted is agriculture. And we're talking about food here, which is very critical. And we're going to be seeing it later, how it resolves, how it leaves us in a situation where we are probably the most food insecure region in the world. So building resilient agriculture and food systems will be very important, and rural development will be very critical in order to see the progress that is required in SDG 1. And if we look at it community-wise, of course, if you look at, we would have mentioned that in the farming communities, that's where you have a lot of poverty because of unemployment, underemployment, and that has even resulted to migration. A lot of people migrating to look for greener pastures, and you have youths too that detest completely. When you mention agriculture, it's not something that is admirable to them. And we can see examples of devastation that would have occurred. If you look at Hurricane Beryl, for example, the devastation, destruction of crops, damage of infrastructure, household incomes, in many cases would have been wiped out. And it also highlighted the vulnerabilities of families that result in many families finding themselves in poverty. Apart from hurricanes, of course, you have issues of droughts, of floods, and that could also result in rising food prices and cost of living, and so on. Of course, we have sea level rise as well, which we're going to be talking about shortly. And this matters because farming communities will suffer, food supply is affected, jobs are affected, local economies are all affected. And that, also requires that the communities must be strengthened if we are to realize any benefit from SDG 1. Now, if we look at it from the interdisciplinary perspective, looking at the economies, of course, farm incomes, fair pricing, and access to trade determine whether agriculture reduces poverty or reinforces poverty. So we need stable markets. They are very essential, and to ensure that there's resilience in the farming or in the food system, and so on. If we look at if we look at health, because all these things are important, they are critical when you are looking at ending or eradicating extreme poverty. But it's a situation where if you look at health, poverty and weak food system drive malnutrition and stunting. But if we look at the graphs that we have here, of course, if you look at stunting and wasting, it's not, look at the Caribbean. The Caribbean here, if you look at stunting in children under 5 and wasting, I mean, we do not have any problem of wasting and stunting. But on the other hand, we have another big problem, which is overweight, obesity. Here is the Caribbean. Of course, obesity is a significant problem for us, resulting in NCDs and other associated challenges. And of course, it results in overburdening of the healthcare system, affecting personal budgets and national budgets as well, and that can affect what the money that could have been used for something else, for development and so on. So all these things are related to the impact that it has in ending extreme or eradicating extreme poverty. And if we look at it as well, look at relating it to food insecurity. We're the most food insecure region in the world, as you can see here. If you look at the global averages, look at this severe food insecurity from 2020 to 2021. Look at these are the global averages, and the Caribbean average is far higher than the world average and far higher than any other region of the world. The moderate poverty, moderate food insecurity as well. And I mean, that shows that we have to look for food somewhere, and that increases the impact that it has on the achievement of SDG 1. Education, of course, does something as an institution, the University of the West Indies, that's something that we do a lot. We have trained a lot of people, and you will see with training, with capacity building, of course, with education, extreme poverty is also reduced because it increases employability and particularly of youth, and it encourages innovation as well. The environment, looking at the environment under the interdisciplinary focus, of course, we have spoken about the challenges of climate change. We have challenges of the land degradation as well, water scarcity. All those are issues that we face, even in the humid tropical Caribbean region, where you have a lot of rain, but yet there's significant water scarcity. Sea level rise. In fact, in one of our researches, we looked at sea level rise, the movement of salt water further inland, damaging, creating land degradation and damaging the environment. We saw that during the dry season, as you can see, there's the further inland, and there's the sea here. We saw clearly the significant movement of salt further inland during the dry season, more than it is during the rainy season, because the blue here simply means that there's low salt, but here, as you can see, it's red and it's yellow, which means salt is moving further inland. So those are some of the challenges that impacts on how our efforts to achieve SDG 1. Policy and governance. Of course, we spoke about the food import bill. As we can see, there's significant, look at Trinidad and Tobago, for example, the food dependence, the food import dependence is about 96%. So we can see, of course, with Belize and Guyana, that's where you see sufficiency. And all this means that you your foreign exchange, there's foreign exchange flight, which also affects the strengthening of our economies to help in addressing the issue of extreme hunger. And there are challenges. Of course, we spoke about inequality, the climate vulnerability, the food dependence, the rising food prices, policies that are not very strong, weak policies that leave us, our economies dismayed and undermines the achievement of this very crucial goal. And so what do we need to do? I'm just moving very fast because I realize that my time is almost fast spent. There are several things that we need to do, practical things like social protection and addressing the issue of nutrition, support for not just farmers, but supporting the most vulnerable and ensuring that their resilience is increased, and also addressing the issue of market prices, technology and innovation, government policies, creating jobs, and so on. And having the private sector also being active, because particularly in our region here, you do not see the private sector investing as you see it in other places, in research, for example, investing in research that will be developmental, that will transform the the system. For example, just the other day we were listening at the judgment that was delivered between Harvard University and the Trump government, where we were told that the Harvard University receives $2 billion US in research grants. I mean, just imagine the University of the West Indies just receiving that for that amount of money. So governments must also step onto the plate to invest in what we are doing. Right. So I've spoken about most of these things. Of course, as learners and professionals, we are relevant in all this. We are key actors in research, in bringing innovation and even development of skills that are relevant, and also fitting into the policies that are developed uh, in our nations and in our region. So in conclusion, I want to say that we have made significant inroads, particularly as a region and as a university. Of course, we have been working hard, impacting and creating the human resource that is required to bring about the transformation that is required. But of course, we need policies, strong policies and strong institutions that will help us in realizing this important goal, which is ending or eradicating poverty by 2030. Thank you very much.
Thank you so much, Professor Odavira. We appreciate that. That was a very interesting and somewhat challenging perspective. And for those of you who may have questions to ask Professor, you'll be able to do that very shortly. We're going to move smartly on to our next speaker, who is Dr. Roberto Teluria Juarez, and he will address SDG 2, and then you'll be able to ask all your questions. Dr. Teleria Juarez is a policy specialist and leader with 20 years operational project and program management experience with the UN, NGO, and nonprofit sectors. Currently, he's serving as a policy officer at the Food and Agriculture Organization of the United Nations, FAO, based here in Barbados. He has an outstanding record in reducing poverty within developing countries, as well as forming high-yield partnerships, leading program design, performance management, as well as driving strategic initiatives and evaluating their impact. So welcome, Dr. Teleria Juarez, and please go right ahead.
Thank you. I'm going to speak today just about SDG 2, which is the second of the United Nations Sustainable Development Goals. And this SDG, is, the main objective is to end hunger, is to achieve food security, is to improve nutrition, and is to promote sustainable agriculture. So it is about food systems. It is about from both supply and demand side. I'm going to share with you some statistics that which are going to be focused on our region, on the Caribbean region, and specifically because we had the benefit from the professor that show global stats. So now we are kind of narrowing down to our region. So I'm going to start broad, just to give an idea about the share on selected countries where we have for which I found stats. And if you can see on the left hand side, the population in general in the countries that are in the sample tend to be rural. In some cases, like Antigua, Guyana, St. Kitts, and in some other cases, like the Bahamas, there's more urban population. So the definition of urban-rural depends very much on each country, and but are not necessarily linked with the level of agricultural activities, which are fundamental for SDG 2, which is about hunger, ending hunger. So you can see on the right-hand side, this is precisely shown where the most of the contribution to agricultural GDP in the countries that are in the sample, for example, Antigua and Barbuda, you can see 67.8% represent services. Industry is 19.4%, and agriculture is just 19%. So it's very small, and that's in fact the trend, in these countries, except Dominica, where we had in 2023 a share of 14.8%. So this gives already an idea of the importance and the amount of resources people working on the agricultural sector. So the next slide shows, well, zooming into the food security situation of the Caribbean. As was shown earlier, in the Caribbean, we have some challenges in terms of undernourishment. For example, if you see the last one on the left-hand side of your graphic, it says average FAO Caribbean, which means where FAO works in the Caribbean countries. In the sample, you see those. There are more countries, but for these ones are the ones that I found data. And it says that prevalence of undernourishment is 6.5, which means that the value of this value means that an estimated of 6.5% of the total population of the countries in the sample did not have regular access to enough calories to meet the minimum dietary energy requirements. So in other words, in almost 7% of the people regularly did not have enough calories to live a healthy life. That is the reading of the. And if we take into account the other indicator, the severe food insecurity, which is not the normal, the regular, severe is really a critical indicator of 9.5. That is indicating. This is an indicator that FAO calculates based on food insecurity experience scale, which is an approach, a methodology FAO uses to calculate the food insecurity. And this 9.5 means that 9.5 of the population of the selected countries, in this case, the average of the sample, the countries in the sample, is living under severe food insecurity conditions. So that means that these people go hungry or has experienced days without eating enough food because they did not have the resources to eat. So that is the interpretation. On the other, we can also calculate that by gender. So this is also an interesting stat, but where you can see that there are not huge difference between male and female in the countries. They're pretty much the same, except in Antigua and Barbuda, where women, if you can see, 37% of the women experience severe food insecurity in 2021, 2023 as average number, where men was 29%. So that is moderate and severe food insecurity. That's why the number is higher than the graphic on the left-hand side. And in the world, if you make a comparison with world female is 27.3, which means that in the Caribbean is slightly higher for females, and in the case of male is 24.9% globally in the world, and in the case in female population is 37%. So those numbers are providing us some indicators of the situation that we are experiencing in terms of food insecurity. So let me come back. I will come back to this graphic, but I wanted just to jump to another indicator, which has been discussed somehow with the professor, sorry. But here we come zoom a bit the prevalence of obesity. For example, in the Caribbean, you can see on the left-hand side, the number is 24.5. That means that 24.5% of the adults of the population are classified as obese. So that means that they have a body mass index which is above 30 kilograms per square meter. And that is, as was anticipated as well, that is a concern because in the world, that average is 15.8%. So we are experiencing issues of overweight in our region. And in the case of children under 5 who are stunted, well, it was already, we are doing actually well in this case because we are quite below the world average, which is 22.3% of children who are stunted as compared to, you can see the numbers for the Caribbean and other selected countries is much lower. Now, let me go to the next slide, which is food supply composition. I think this is a very important slide because it's showing what we eat. Why, if we are saying that we have issues of obesity, if issues of food insecurity, what is going on? And these are indicators for specific countries, as well as we have an average for the Caribbean. So the reading here is that all what we intake makes 100%. So we intake cereals, we intake dairy, we intake fruits and vegetables. So this is our regular intake. And here, for example, in the Caribbean, the cereals represent about 30% of our daily intake. But we have dairy and eggs a bit well, it's rounded. That's why it shows a 0.0, but it should be 0.06. It's a fraction, but it's a small percentage. And if you check fat and oils, it's 10%. Fish and seafood is 0.0 something. It's not completely zero, but I'm just using one decimal number here. That's why but the message is that it's a low number. Fruit and vegetables, 10%, meats, 10%, and roots and pulses, 10%, and sugar and beverage and others, 20%. So it is quite rich. If you see our diet in general, it's quite rich. About 50% of our diet, if you take out cereals, excluding beer, of course. So we are talking about calories mainly here, and we are talking about sugar and beverages, the other 20%. So it's about 50% make these two food groups, which show what is our trend in our consumption. And the next slide is the cost. So we are saying in this story that we have a challenge here in terms of obesity. We have also a challenge in terms of food insecurity. So those seems to be a contradictory, right? Because to some extent, it's telling us that there are some shares of the population that do not experience necessarily problems of financial resources or not huge problems because they can eat, but they are not necessarily eating healthy. Because there are obesity issues. But and on the other hand, we have other segments of population that they just don't have enough resources to afford a healthy diet. So when we talk about healthy diet, and now let me come back to the previous, what is healthy diet? The healthy diet in the FAO conceptualization includes specific goods that are healthy for us to eat. So those are food categories of food items that allows us to have a healthy life in terms of sport, in terms of not having issues as health issues associated to the intake of foods that are very high in salts, very high in sugars, very high in fats, etc., etc. So FAO classifies in general, of course, this classification varies from country to country on the following: staples, for example, includes the reasonable amounts of all of them. Vegetables, very important in a healthy diet. Fruits, very important. Proteins, of course, very important. Oils and fats are important in reasonable amounts. And other nutrients as well. So I want just to show here what is generally referred as a consumption basket that is considered healthy. And what doesn't include this healthy is the ultra processed foods. For example, everything that is most of the foods that have very high contents of sugars, of fats, which are in many cases labeled. In many countries, they are labeled, or there is information for the consumer on the label of the product. Those are not healthy, not considered healthy foods. Alcohol and stimulants are not included, and foods that are not contributed to nutrient requirements are included. So how much cost? Let me go about this. The cost of healthy diet. So FAO made an exercise and tried to identify how much cost if you are you all have families, right? So per person, how much cost to eat healthy per day in US dollars, and US dollars that are comparable from one island to another island. So in the first you can see it says average Caribbean, FAO Caribbean 5.8. So that means that the cost of the healthy diet I already show you the consumption basket is $5.8 per person per day. And this is measured in what is called the purchasing power parity, or PPP, which is a methodology that allows comparison, the comparison of adjusted dollars from country to country. So and this cost is this consumption basket is the least expensive set of locally available foods that meet the national dietary guidelines for a healthy diet. So this is, you can see here, the average is 5.8. In Trinidad and Tobago is 5.6, but there are some countries where it can be quite expensive, $6.8 in the case of Guyana, which is the most important. If you make a comparison with the world, in the world, the cost of a healthy diet is 3.96. So we are quite high. And you see that, we all see that when we go to supermarkets and we try to buy fruits, vegetables. They can be expensive. I mean, eating healthy can be expensive, and this is something. It's an area that we need from all of us to work and see what, from our own position, what we can do in order. And I will explain you what FAO is doing to try to make the cost of healthy diets more affordable for everybody, because we already saw that we are not eating very healthy. You saw here in this graphic, our food composition is not very rich. You can see the meats, 0.1, 0.2, 0.1, or so. This is 10%, 20%, 10%, 10%. So it's just 10%, except some beans that is there is 20%. So meats contain proteins, are very important. Fruits, you can see fruits and vegetables. Likewise, 10, 10, 10, 10, 10. Just Dominica, 20. So it is important to see, and the reason why this is happening is because families, if they want to eat healthy, they have to have first the resources, and second, prices that need to be more affordable. Let me go to the next slide. Okay, so we had this slide about the cost, and the next slide is the affordability, precisely. affordability of diet. So what does it mean? Affordability means that how much of the population, let's start with that one example, 25.4. That means that 25.4% of the population in each country of the sample, or more or less 1 in 4 people, could afford a healthy diet in 2024. That's the reading. In the case of Belize, for example, is the country where most people can afford. 62.4% of the population could afford, but Guyana has the lowest 4.9% of the population. That means that when we talk about affordability, we basically talk about prices. So the relative prices of those items that are healthy can be quite expensive. So this is more or less an overview. I can, or if you're interested, I can always share these stats with Dr. Pilgrim for you to have. Most of the data. Sorry, I didn't put, and I should have put it. Most of the data they come from FAO stat. And what we are doing in FAO, well, we are trying to work in different areas in order to strengthen SDG 2. We are, first of all, we have the mandate, which is end hunger by 2030. This will be very, very difficult, as the professor already mentioned. It will be very difficult. We are just 5 years from now, and there are so many challenges. And you saw the numbers in terms of the number of food insecure people. And in order to lift people out of this food insecurity situation, is needed either to make the prices of food more affordable, which will allow just people to go to shop in supermarkets, in local markets, and having access to those. And the other option, which would be complementary, would be to try to make the income part of those households that are experiencing problems of food insecurity to increase their income sources. The income sources can come from their own salaries, can come from properties that they could rent. They can come from support they receive from local institutions or governments, some kind of subsidies, or support from NGOs, groups, etc. So all these sources of income are the endowments that the families could have and households could have in order to increase their capacity to purchase in local supermarkets or markets to go. So what we are trying to do is we are precisely working on field projects where we are trying to introduce technologies for farmers in order for them to improve the yields of crops, the yields of fruits, vegetables, technologies related to the use of fertilizers, seeds, pesticides, insecticides, mechanization, of course, digitalization of agriculture, use of drones, use of solar energy, use of smart irrigation systems. It's a package of a lot of several initiatives, projects that we basically canalize technologies that are being developed by FAO or in collaboration with partners, not only in the Caribbean, but globally, and try to offer that technology and implement in coordination with the ministries of agriculture. But we also try to measure what is the monitor, so FAO has a large program globally, including the Caribbean, of course, to trace and analyze food insecurity, obesity, all the indicators that we just show in order to see how progress is being made. We also implement projects related to improve nutrition, and this has to do a lot with basically awareness, campaigns of awareness. But it's not only about campaigns, because we can make a lot of campaigns, but even if you are aware of that fruits and vegetables are healthy, but if you don't have enough funding to cover that, so no matter how many campaigns you do, you won't be able to enhance or improve your diet. So it's important. It's important that all these campaigns are seconded by projects and programs that need to be, of course, led by the ministries of agriculture. All these exercises include measures for sustainable agriculture. It's a must for us that the use of agricultural resources need to be made in a manner that is sustainable. We are particularly concerned about the use of water, because water, as you know, is a non-renewable source. It's without water, there's no agriculture. And fortunately, we have relatively good rains in most Caribbean countries, but we need to harvest that water that comes from rains. And there are these countries in general are not water short. There's no water shortage. There is water stress, which is different. Stress is because we are not collecting all the water, but the water it can be available. Of course, capacity development. My last slide is about what you can do. I mean, this is SDG 2 is not only about the government, it's not about only the international institutions, and it's not only about the universities doing. I think we all have a responsibility here. And as if you are young professionals or you are a student, there's so many things that you can do in order to try to improve food security in your country. First of all, from my recommendation, always engage in research and innovation. This is absolutely important. There's never a sufficient research. There's always gaps, and that those gaps need to be addressed and put to the attention of decision makers. Promote nutrition awareness is important. Well, this is the last one. So
okay. We
yeah,
need to
let me
leave
stop.
time for questions, though.
Yes,
So.
please. Thank
And
you.
I thank you so much. You can share your slides with me, and anyone who's interested, we can make sure that we provide that. I want to say thank you very much to both of our presenters, and I'm opening up the floor for questions. Just raise your hands and I will call on you so that you can ask your questions. Thank you, Roberto, and thank you, Professor Rodevira. Do we have any questions at all? I have a couple if you don't. Ladies and gents, any questions from the floor? We have 9 minutes left. All right, well, I will ask a couple. So both of you mentioned that we have significant challenges in the realm of agriculture, and most of these challenges centered around either insufficient food, or the food is too expensive, or people just cannot afford the types of food that we can do. Both of you listed some things that individuals can do. What do you think is the most important thing for individuals to do and for governments to do to address some of these challenges? Either one of you can answer.
All right.
I was suggesting that the professor could start.
Okay.
Okay, no
Right.
problem. Go ahead.
Okay, let me go first. All right. The question is, what do we think?
What is the most important thing that individuals can do, and what is the most important thing that governments can do?
At the individual level, it is important that we ensure that we do not see ourselves as not part of the solution, because most times our attitude is that it's the government. The government has to do everything, but I think a lot depends on us as individuals. There are opportunities that abound through, as we would have mentioned. There are innovations that we can use. There are things that we can do that do not really require the kind of funding that we are talking about, and so on. So the little that we can do as individuals, it's important. What is the contribution that we are making in talking about food? What is the contribution that I am making in trying to produce something that I could eat? Something. It might not be everything, but there are technologies, inexpensive technologies for backyard production and urban production. You don't need, now you don't need 7 acres. You don't need even an acre of land to produce food. And when you produce your own food, which is, I'm not saying that you are able to produce everything that you eat, but when you produce your own food, you have control on what is added to it, the kind of chemicals that go into it, because that's another significant issue that we have. And talking about government, I think an area that is very, very critical, which probably we did not address here, is the area of hazardous chemicals, pesticides that are being used. And I think there should be regulations, strong regulations, strong policies against some of the usage. I could remember last year in a meeting, one of the ministers who was chairing a ministerial meeting, what he said was that our people are dying. That was how he started. Our people are dying. And I was waiting, why did he start like that? He said they are dying from chemicals, overuse of chemicals in agriculture that is resulting to cancers and so on. And the next question that he asked was, what is UE doing about this? So, so I think policies are important. Regulations are important in how some of these things are used, and enforcement, because you can have whatever laws and so on. If they are not enforced, we still come back to the same thing.
So you are suggesting then that we should personally grow some of our food, and that government should have policies to enact to regulate some of the chemicals that they're allowed to use in agriculture.
Exactly.
Thank you. Thank you. And Dr. Taylor Juarez, what would you say?
Well, I would say that the most important single thing you can do is research. If you identify a topic and where you say you want to document and something related to poverty or related to food security, to hunger, you should do research, and the university should support that kind of research by promoting the research to the local media, to radios, to, if possible, to TV or social media channels, some kind of acknowledgement and recognition of the students and the professors and researchers that utilize their time to publish and to call the attention of policymakers on things, on areas that are likely important to the ministry, because there's no point in doing research on for example, on this reproductive cycle of monkeys. What would be the impact, unless there's an issue of that? But if you do research on something that is important, let me give a quick example. We're speaking about the food, the prices of food in the on Caribbean countries. Let's take the example of Barbados, because we live here. Why could be, for example, the price of food a bit, let's say, perhaps not affordable to all the healthy foods? Part of the explanation is the import tariffs. Import tariffs can be 40%, and in some cases can be more. There's a common external tariff. So it would be important to try to understand, do some research on how how this import tariff, the import tariff is a tax. It's a tax that we don't see. When you go to supermarket, there are two taxes. The VAT, that is 17%, and that you see very clearly in your receipt. Is clear, is displayed, so you are as a consumer, you know that you are paying that VAT. But there's another tax that is hidden and you don't see, which is the import tariff. That at the moment when the food arrives to the ports and the customs authorities allow this food for the supermarkets or the other importers, that 40% or more or less is there and is included, because the importer is not absorbing that cost. The importer is transferring that cost to the end consumer.
Right.
So there are what is in general, I would say is doing research is very important, but do research on whatever you want to change. If you want to change something, and it should be important for the government, should be important for consumers, and of course, it should have the support of the university. Otherwise, that research will end up sleeping in a library or in somewhere and not without any impact.
Yeah, Dr. Pilgrim, let me just quickly add to what...
20 seconds, because we're going to close this.
Okay, right. So just to indicate that the issue of research cannot be overemphasized, because even the policy that I was talking about, it has to be, based on evidence. And so research becomes very, very important. And of course, I spoke at an individual level. It's not just producing something at the backyard. Of course, you need the education as well. Education is very critical. And of course, we collaborate a lot with FAO. In our faculty, for example, we collaborate a lot. We do a lot of research. We try to bring things, but it is important that there's connection, that this fits into the policy that is coming out. Thank you.
Thank you so much. Ladies and gentlemen, I would like to thank our presenters for their innovation and their interesting presentations. And I want to leave you with the International School for Development Justice. Several of the programs on the site, I put the site in the link, relate to the SDGs that we looked at today, especially sustainability management and sustainable educational leadership and management. So, ladies and gents, thank you so much for coming today. We want to end on time. I look forward to seeing you at the next webinar, which will be on October 15th, and it will be on SDG 3. I look forward to seeing you there. Have a great day, and thank you for sharing your time with us. Bye-bye.
Thank you. Bye-bye.
Thank you very much. Bye-bye, everyone.
Bye-bye.